My name is Chughtai. I'm a urologist who practices in the Plainview area. I specialize in functional urology and enlarged prostate. When it comes to patients with BPH and selecting out who does well with which therapy, specifically when we focus in on to Optilume, I find patients who are looking for preservation for sexual function, specifically ejaculatory function, and those who are really looking for a long-term durable outcome and are able to tolerate a catheter for a couple of days. So when it comes to insurance approval for any therapy, it does make the conversation easier with patients. When you don't have a Category 1 code, sometimes the conversation does drift a little bit into what is the out-of-pocket cost, what does that mean for me? But now that there's Category 1 approval, it allows us to move these patients along on the appropriate therapy for them. So one thing that makes Optilume particularly unique is that when you're talking about some other therapies that we do, there is a lot of intraoperative or real-time decisions that you're making in terms of where to deliver therapy, where to remove tissue from. Optilume, what makes it really unique is that every single time you're performing that procedure exactly the same. So the learning curve is relatively quick. I would probably say within the first 5 cases or so, you have the technique down. As long as you're properly selecting patients, the procedure works really, really well. When it comes to the early time in the learning curve for Optilume, I think important things to remember is you really want to have a good measurement of the prostatic urethra, so you know exactly what you're up against and you have the appropriately sized balloon. I think it's good to also set expectations in terms of if someone's got underlying diffuse or underactivity, overactive bladder. I think those things are particularly important. I think when it comes to the actual procedure itself, you know, keeping in mind of the steps of watching the balloon and making sure that you see the atmospheric drop with both the pre-dilation and the dilation is important to see as well, and just make sure you have a timer going. But I think ultimately the steps are very straightforward even when it comes to the first case. So when it comes to how to perform the Optilume procedure, it is a relatively straightforward procedure, but basically with every patient we do a preoperative workup, which includes a cystoscopy, ultrasound in the office, and some form of flow test, whether it's a uroflow, urodynamics, urocuff. When we get to the operating room, the same patient will remeasure the prostatic urethra to make sure we know its exact length. Now, depending on the prostatic anatomy, there's a variety of ways for us to do our pre-dilation. Some patients will do a pre-dilation balloon. Other patients, depending on their anatomy, we may end up doing a incision of the bladder neck at exactly the 12 o'clock position. Now, keep in mind with this technique, it's something that we're developing. We're tracking our patients very closely with a registry, and our hope is to see, compare that technique to existing techniques in the future. So with any procedure, it is important to set expectations, especially when it comes to blood in the urine and hematuria. Obviously, for most of these patients, they've never seen blood in the urine before. So you want to set the expectation up front. Like, you're doing a procedure that's going to create an incredible anterior channel, give you incredible results when it comes to uroflow results, post-void residual results. But part of that is that there's going to be a healing time. And during that healing time, you're not applying energy to the prostate, you're not leaving a permanent foreign body. So there is going to be some expected bleeding. So I do set the expectation that you are going to have blood immediately post-procedure. The catheter will be on traction, there'll be some pulling immediately after, and afterwards you will see some blood in the urine, and it could be for a few weeks post-procedure. I think where Optilume really shines is when you look at its functional outcome, it's got one of the highest Qmaxes we've seen for any minimally invasive therapy. In addition to that, I've always been surprised, but when we take that catheter out, the results and the reaction from the patients being like, whoa, I've never seen the flow like this before. It's pretty incredible. And I think for a minimally invasive therapy to be able to give you ejaculatory sparing, right? In other words, no change in ejaculation, and give you this very durable and improved Qmax is pretty incredible. Right now, we're tracking every patient very closely, and we see them on a very regular interval. And I would say almost all of our patients have expressed very high satisfaction with the Optilume procedure. So I think when you're developing a BPH practice, or if BPH is an area that's of interest to you, I think it's important that you don't have a single tool that you're telling every patient to have. I think Optilume does fulfill a lot of very important criteria, especially in terms of sexual function and functional outcomes. I think Optilume is a really important part of the armamentarium when you're treating patients for BPH.